Hello everyone. Today we're going to talk about the learning activity that we're going to perform coming up in the next couple of days. This activity is going to focus on teamwork and collaboration, one of the nursing competencies that are very important. This activity is going to consist of a simulation. This simulation is going to help the student learn to collaborate with other disciplines, to learn how to lead a team in times of change and crisis, also to learn to respect other people of other teams, and listen to their recommendations and receive them with professionalism, and also learn how all these things work together to create a better patient care experience that is of high quality. So the objective of the simulation or this activity is that the student will appreciate the interprofessional collaboration and acknowledging of others' abilities to contribute to the care of a patient when there are times of serious need. The student should learn to value the expertise of other professions such as physicians, respiratory therapists, even the patient care assistants on the floor, as well as charge nurses and nursing managers. The influence of certain systems also can affect how a nurse will care for a patient. With the simulation, the nurse will see how all these systems they work together, although they're individualized, to create the best outcome for our patients. Also, the description of the simulation is this, that the nurse, we will call her the lead RN, is caring for a patient that was received on the unit earlier that day. When she comes in for a shift, she gets her hand off. She learns that the patient is a congestive heart failure patient and they're having an exacerbation. So the plan of care is to diurese this patient, of course, and also to monitor them on a heart rhythm monitor. She goes in to do her initial assessment and finds everything is seemingly okay. The vital signs are normal. Patient is comfortable, is oriented and alert. All the equipment is set up properly, etc. She goes around to the rest of her patients and she begins documentation after she's seen these other patients that are not at the same high level of care as her first patient was. After she's done doing some documentation, she goes and makes her rounds about an hour and a half later. And when she goes into the patient, she finds that the patient seems a little anxious, restless in the bed, looks confused in the face. So what she does is start asking questions. Do you know where you are? Do you know why you're here? And the patient's responses are rather confused, delayed and confused. So she decides to do a focus assessment. She will go in, she will do her cardiac assessment, check circulation, etc. And she decides to take the vital signs, which is appropriate because the patient's lungs are not sounding as good as they were before. When she does take the vital signs, she finds that his vital signs have changed, and they've not changed for the better. So basically with the simulation, it's going to provide that the nurse calls what's called a rapid response, which is a team that will come in and will help to escalate care of this patient so that they do not decline further. So basically this simulation stems from that nurse recognizing these changes, understanding what these changes are, initiating a rapid response, knowing how to instruct other members of the staff that are on the floor currently and what to do to help her with this patient. Also, when the rapid response team turns up, she will need to know how to communicate with them. The physician will show up, she will communicate with the physician. I want the student to be able to know automatically, okay, what do these signs mean? Be able to relay this information, listen to other people's feedback, give suggestions of what they think should be done, listen to suggestions of what others should be done, and recognize that when certain people show up, the leadership role changes. It can change back and forth, or it can ultimately end up with just one person. Also, I want the nurse to determine, is this patient going to have to be escalated to a higher level of care, namely an ICU? If the nurse determines this, she will have to perform a handoff to the next nurse that will be receiving this patient. And we want to make sure that students understand handoff on any patient, whether they're in okay condition health-wise or they're declining like this patient will be, is very important. Details are important. There are minor details that they don't need us to relay, but the student's going to have to learn that themselves, what's important, what's not important. And we will have another educator playing that handoff nurse, and she will interject, I don't need to know that. That's not important right now. What is this? This is what I need to know. What kind of net, various things like that, just to get the student thinking critically. Especially in this kind of situation, it's very important to get the patient handed off as soon as possible. This simulation is going to be it's going to be not graded, but let's say evaluated on a satisfaction score ranging from unsatisfactory to, excelling at this situation. In order for the student to be their best, we are wanting them to get more than 50% of the criteria that is outlined in the learning activity sheet that will be provided. We want them to get more than 50% of that as satisfactory, and that because that will show that they're starting to understand how these critical thinking issues work. Also, at the end of this, I will make recommendations. I will provide positive feedback. This is what you did. That was great. Keep this up. And also, I will provide areas that I think maybe a little concerning, but not so much because they're newer students, and it takes time to learn how to progress and learn how to do these things properly. Also, I'm going to require that the student write a 1 to 2 page paper after the simulation and discuss their personal strengths that they recognize in themselves. Give themselves a little praise, build themselves up. But then also I want them to recognize that, yeah, there are weaknesses. Everybody has them. Even nurses that have been practicing for years have weaknesses. And I want them to be able to recognize that, and then also provide ways that they feel that they can help themselves improve in that area. This simulation is going to consist of a case study that I have created. And it's similar to what I've already discussed, but the only person that's going to get the copy of this case study is the lead RN. So everything is on their shoulders to be able to recognize the situation and escalate care and help get this patient the quality care that they need. And also in the simulation case study, I want the nurse to be able to recognize what some of these vital signs mean. So I've listed a set of questions for them to think about prior to the simulation, because they will be provided this case study a day in advance. And there's several questions on there that ask certain things like, what do you think you're going to tell a rapid response team? What does the physician need to know? What assessment findings are important for everyone involved to know? Why do you think this patient's declining? What are his signs and symptoms? What are they telling you? What kind of medicine do you think he'll need? Certain things like that. And I give it to them a day ahead of time so they can do their own personal research, and I mainly want them to use our textbook. And if they use any other sources, I want a list of all the sources they used in APA format and given to me prior to the simulation. So, but hopefully it won't be too scary for them, because simulations can sometimes be, but we'll try to make it as fun as possible so that it can be a positive learning experience for the students. All right, thank you, and we'll see you.